Susie, have I got digestive symptoms? Have I got IBS? Have I got bloating? Have I got indigestion? Have I got reflux? Have I got diarrhea or constipation or pain in the digestive system? Mm-hmm. And that's the first thing that will give you immediately an indication, because if your gut flora is normal, you cannot possibly develop any digestive disorder. It simply cannot happen, because your gut flora is the housekeeper of your digestive system. It will make sure that it's healthy and well and vibrant and doing all the work it's supposed to do, and nothing wrong can go there. So before you develop any digestive symptom, you've damaged your gut flora first. Usually through a good course of antibiotics, or several courses of antibiotics, any other prescription medication. Contraceptive pill is an absolute onslaught on women's gut flora. It messes it up seriously. It decimates it. And women have to take contraceptive pills for quite a few years before they decide to have a child. And that's a long period of time to be damaging your gut flora. And there is a problem with that, a big problem, because babies acquire their gut flora from the parents, largely from the mother. So if the mother has abnormal gut flora herself, that is what she will endow her child at the moment of birth. So these babies start their life with abnormal gut flora, and that is a major cause. This is a GAPS baby, a major cause of initially of colic, and then eczema, and then diabetes type 1, autism, dyslexia, dyspraxia, ADHD, rheumatoid arthritis, psychiatric disorders, you name it, anything. And we have an epidemic of these disorders, because what I see in my clinic, that the damage to gut flora passed through generations is getting deeper with every generation. Particularly after the Second World War, after when antibiotics came on the market, and in the 50s and 60s for the first time. So if a grandma had a perfectly okay gut flora, and she had a couple of courses of antibiotics before having her daughter, maybe in the 60s or 70s, so she passed a slightly damaged gut flora to her daughter at the moment of birth. Then the daughter grows up in the modern world, where antibiotics were given to her throughout her childhood for every cough and sneeze, damaging her gut flora further and further. Junk food came on the market at the same time, which feeds almost exclusively pathogenic species of microbes in the gut, all these processed carbohydrates. And then at the age of 14, 15, she went on a contraceptive pill, which she took for quite a few years before she was ready to start her family. So by the time she's ready to have her first child, her gut flora is seriously damaged. And that is what she's passing to her baby at the moment of birth. We have an epidemic of gaps, epidemic of abnormalities in the gut flora, and with every generation, that epidemic is getting deeper and deeper. And that is the epidemic that is underlying our epidemic of autism. I don't know if you know this fact, but when I started practicing as a medical doctor some 25, 30 years ago, we were diagnosing one child in 10,000 autistic. Today we're diagnosing one child in 35, 37. And scientists have already projected that curve, that graph. By 2025 or 2020, sometime in that area, we'll be diagnosing one child in 2 in the English-speaking world. Half